Welcome to Karaoke Wine with Jules and Tessa.
To Karaoke Wine.
Karaoke Wine. We have a very special guest with us today.
Dr. Paola D'Aleman. She is the CEO of the Lifestyle Medicine Wellness Center. Yeah? Okay. So she is board certified, and she is from Colombia. She has 11 years of studying and 15 years of experience in the field under her belt, and that is when she decided to transition into lifestyle medicine.
Correct.
So Somaentis is here in Boca.
Correct.
Yes.
And you take it off.
Yeah, it's a beautiful, beautiful space. Very calming, relaxing, and one of the reasons we wanted to sit down with Dr. Paola, I like to call her, is that she is a wealth of knowledge, and we're excited to kick off a series with her. So it'll be exciting. This is one of some.
One of three.
One of three. And we'd really like to hear your own words a little bit about you and what made you come into lifestyle medicine versus your traditional medicine that you were in.
It's a nice story behind, but thank you for the invitation. And yes, this become a series of conversations. It was supposed to be the conversation today, but we figured out that you guys might going to enjoy more of one conversation. So my name is Paola D'Aleman. I'm a board certified physician. I have 3 boards and 1 certification. I've been doing this for a while. Now, through that process of being doing this for a while, I had to reinvent myself in the process. So it was a moment that due to the health system, which more than a health system is a sick system, made me just re-question what I was doing. So in that process, I discovered lifestyle medicine, which is basically a branch of traditional conventional medicine, which is how I was trained, but it has been highly adapted by other type of medical doctors in the functional field, in the alternative field, because it's based on the 6 pillars of maintaining your good health. And those 6 pillars are...
I was like, I love these. Yes, what?
It's just because lifestyle medicine actually was born in Loma Linda, California, in a university that is there in 2010, but I didn't discover it until like 2020. So I thought it was something new. I actually had to Google it when I went to this conference. It was a women's physicians conferences, and I was in the process of reinventing myself. And when they brought up this, I'm like, doesn't exist. So I was Googling, and I noticed that it is indeed a branch, and now we have a board. So actually I have to sit down, study, and write an exam to board certify me in lifestyle medicine. So the 6 pillars of lifestyle medicine are nutrition, movement. We don't call it exercise because that might trigger something in some people. Stress management, your sleep health, the toxic substances that you're exposed to, and mainly tobacco and alcohol and other drugs. But I like to see it as there is other behaviors that are part of that toxic environment that we stay. And the last pillar, which is one of the most beautiful one, but the ones that we forget the most, it is meaningful relationships. So how we relate to other people for the meaningful, deep concept. So those are the 6 pillars, and we really believe with those 6 pillars, we are able to take care of a chronic disease. Like it's actually been proven that many diseases can be just been reversed. So many studies prove that lifestyle medicine, put in a very individualized way, you could reverse, example, diabetes type 2. You could improve any cardiovascular risk. You can manage weight. You can, and many cancers that are directly related to the environment can be treated with lifestyle medicine. And why not? And yes, medications are welcome. At the end, this is modern medicine, but can we leave medications as an instrument and not like the first step to go to? So lifestyle medicine is not against medications. It's just about if we need it, we use it. We surveil the medication, and then we de-prescribe if it's necessary. And arriving to an objective. And obviously, lifestyle medicine has a lot of space on the preventive medicine type of. So you don't have to have a chronic disease, but you can avoid that chronic disease if you are approached by a lifestyle medicine doctor early to optimize your metabolism. So this is how I opened the doors of lifestyle medicine, but that brought me to more fields. So when I opened that door, and it's not as simple as everybody thinks. It's not just like eat well and exercise, like most of the doctors will tell you. It is more complex than that. And I see it as it's a very individualized way of approaching your life in general, because it's about your life. It's not only your health, but it's anything that surrounds you. So in that process, I decided that I needed to know more about obesity, which is an epidemic in this country and in many other countries, not far behind. And it is a chronic disease. So we've been always biased by the fact that obesity is a problem of willpower. And it's
or
not.
laziness. I mean, I will be the first one to say, like, I would see someone that was obese and be like, it's not that hard. Like, don't eat the sweets, don't drink the soda, and go to the gym.
Yeah, unfortunately, it's not that easy.
Exactly.
It's a metabolic dysfunction.
Yeah.
And not everybody has the same type of metabolism, right? So if someone has a certain metabolism that responds that easy to those approaches, well, excellent. It was an easy way to arrive to our goal of is decreasing the weight and put you in a healthy weight. But there is many other reasons why you are suffering of that chronic disease, and it won't respond to those specifics. This is when precision medicine and individualized medicine comes in. So being obesity, a chronic disease that we have to start educating everybody about how these people should be treated almost like a diabetic. No one judges a diabetic person.
Right.
And because he's diabetic, oh, you ate too many candies when you were a kid. Not really. And no one is judging them when they use insulin. So a little message here, let's stop judging people who suffer of obesity and requires a medication like GLP-1.
Right.
So that's a lot of things in social media, and we know this is a medical condition, and thanks God we have some instruments like GLP-1. I'm not saying everybody needs it, and again, as an instrument, won't work by itself. It requires lifestyle medicine for that specific approach to be sustainable. So that obesity, chronic disease, opened the doors for me to sit down for the Obesity Medical Association boards, the American Board of Obesity Medicine. And so I learned tons through that. I understood the disease way better. So it's multisystemic, all the behaviors behind, and how we could help someone to give them the roadmap to arrive to a healthy weight.
Well, I think that's important for people that are overweight, are obese, to not just immediately go, I'm never going to get to the gym. I'm never going to get to size 4 or size 6. But to, if they look at it as a disease, saying, I can go somewhere professionally and they will look at me on the inside out and tell me what to do, I think it will be more easier for them to come to that point, rather than going like, I need a trainer, I need to do this, I need to do that, rather than going, first step is going to see a lifestyle.
Learn your body.
Correct.
Absolutely.
It's so, like you mentioned earlier, and I love that it's centered around individualization, right? Because it's definitely customized care. Not two bodies are going to be the same, and you're actually going to see Jules and I did something really exciting with Dr. Paola. So we're going to go through what that was. It's called a DEXA scan. Before we jump into that, I think it's important because you did mention the GLP-1. We are talking about more of the obesity being more of a chronic illness, that you do have resources outside of social media that are medical professionals that can actually get you that roadmap to get you to a healthier space where, you know, we found, and I myself have used GLP-1s after I took medication, that a lot of what it is getting rid of is good muscle mass too. And if you are truly in a space where you are unhealthy inside and out, walking through the steps that we're going to go through today is a much safer and healthier way to get the weight off and keep the weight off. And I think that's the number one thing, is everyone's looking for a quick fix. And that's, you know, it is easy to do an injection and lose all the weight. But what happens once the weight is gone? How healthy are you on the inside? And that's why I'm very interested in my results, because it very much shows what happened, which is interesting to me.
Yes,
Yeah.
you touched an important point,
Yeah.
and it is this market outside there, right? The
Yeah.
influencing, the social media. So many things that are supposed to be medical,
Yeah.
is medicalized, might gonna open the opportunity for business. So maybe the message that I can send here, it's the middleman should be an expert. And that's why I sit down for all these boards. That's why I just like consider myself a metabolic expert. I sat down through my books and wrote an exam. And I've been doing this for years. So I understand your physiology, your metabolism. I know exactly how unique you are. So this is why I love the word precision medicine, because it's very precise. It's not your 9 minutes sitting down with your PCP in and out who doesn't even remember what was your latest lipid profiles that he had in front of him. So no, it is very unique to you. Your labs are very unique to you. And this brings to, how do I know how unique you are? And it has to be some neutral, it has to be some objective data that we are gathering and that is so unique to you. That's objective, and I can obtain all this from a lot of new modern medicine. So one of the things that we just mentioned here is the DEXA scan, which is not a new technology. It's a machine that it was invented to diagnose osteoporosis. But what it is new is the new software that it is creating these different compartments of your body, full body scan, and it tells me exactly how much of your weight it is that fat, it is bone, and it is your lean mass. And that's so important to know it. And we had a conversation that should be almost like a vital sign. Everybody should be having one DEXA scan a year. It's an irradiation machine, but it's a very low irradiation. It's 1/10 of an X-ray. It's being in a plane between LA and Miami. So it is somehow worth it. I'm not underestimating the fact that it is radiation and we're women, we have to go through mammograms, all these things, but at least to have that knowledge of your body composition, because everything starts from there. So your body composition determines where your metabolism starts, and not eyeballing or the number on the scale. So that's the first thing we're going to debunk here, the number on the scale. It's not telling the whole story. The number on the scale is simply giving you a number, but you don't know how much of that number it is your bones, your muscle, which you should not negotiate that way. That way should stay with you, because aging makes you lose muscle every year, and you want to keep it as much as possible. So the rest is fat, but where the fat is makes a huge difference. So we know that if the fat, it is deposited around your organs, what we call the visceral fat, which is inside your abdomen, this is the fat that is metabolically active and is going to make an impact in your cardiovascular health in the future. So that's the first thing that I would say a metabolic expert who has a patient that already went through a DEXA scan should have a conversation on. So first, how much visceral fat do you have? Because this is what I need to act on as a preventive measure. And then the next is like how much total percentage of fat you have. Then most probably is what is left in your subcutaneous tissue. And then we went into details because there is a lot of studies saying that some of this subcutaneous fat, if it's deposited around your hips and your legs, which is very female looking, it might be protective more than not protective. Like social media is teaching us that too much percentage of fat is not the way how you should be looking. So, but still, I understand that we're women. We don't like a lot of percentage of fat that it makes us increase in sizes. We still can take care of that fat. The next conversation is how much muscle you have. Because such a thing, it has been dismissed for many years. We're a generation that we are exercising. I mean, your guys are a different generation than me, but my parents never exercised. We exercise more, and we're passing over all this message to the generations under that muscle became is the organ of longevity. It is something that is non-negotiable. If you don't use it, you lose it. So you want to use it. You want to go as far as you can with this muscle, because the older you get, things that you cannot control, the older you get, a percentage of muscle and strength is being lost.
I mean, we grew up with watching Madonna, and Madonna is what, 60 now, and she's like a badass. J-Lo's 53.
Jennifer Aniston,
Yeah.
and Charlize Theron.
Yeah, so-
you've got some babes out there that are taking this
Yeah.
very seriously.
We're looking at them going, okay, what are they doing? They're
Right.
10 to 15 years older than us. You are in your 50s. I'm in my 40s. She's in her 30s. So
Yes.
We're
We're doing
the
the
sprinkled.
Yes,
Right.
3 generations.
We're
yes,
all
3
doing
decades.
the same thing and we all have different results, but that's okay because where we are in our life cycle, it's normal to be a little off.
Yes. And I love that you're talking about this because I do believe that your generation is getting curious early enough. So that's so preventive.
Yeah.
Right? So what I do, the other things about my certifications is like I attract a lot of women in midlife. I start attracting them as a lifestyle medicine because many of these women arrive into perimenopause, mid-40s, 50s, now 60s, because there is some of the boomers that are there ready to continue living longer, right? Yeah. So these women come to me and said, I'm starting to lose that. Lose bone mass, lose muscle, lose my mind.
That's already happened, ladies and gentlemen. For me.
Let's organize you. But because we are a revolutionary generation, thanks to social media, we're loud.
Yes.
This is sending message to the younger generations to not arrive to this stage because of the lack of education, losing what you already have and you could maintain it. So absolutely. If we're going to talk about muscle, we're going to talk about muscle at 50s and 40s, at 30s, and 20s.
And I think it's important to note because we're going to do a 3-part series. If you just want to do super high level, just to educate our audience on pre and post menopause and what menopausal women, what does it actually mean? We're going to do a whole episode on it, but because we are talking about our DEXA scan results today that are centered around this topic,
Totally pertinent.
Give us like a 30-second, just quick overview of what that actually means.
Yeah. Definitions 101. Menopause is only one day in your life. So
Did not know that, by the way.
Yep, just one day. You're menopausal that one day. It's exactly the 12th month after your last period. So March 2024, then your last period. Then on March 2025.
It's the 1-year anniversary of the death of your menstrual cycle.
It's a celebration of life, not the longer living.
But you don't wear black.
No.
No.
You wear white.
You are not happy. You are not happy. Yes, finally you can wear
You wear
white.
white and not worry about it. That is lengthening, and that is out the window.
I love
White
it.
for the rest of your life.
So that's your menopausal. Because the day after you're menopausal, you're postmenopausal until you're dead.
Yeah.
You're always postmenopausal from then. But before
Premenopausal.
premenopausal, but I would say perimenopausal is when you start having a lot of symptoms. And those symptoms can be 160 symptoms, by the way.
Yes.
So not the hot flashes only. This is what we're going to be talking in the next podcast. You guys are going to love it because from itchy ears to burning sensation to frozen shoulder.
Oh my
to-
gosh.
No, the hot flashes are just the symptom that we always like relate to, but it's a lot of things. But nobody ever made a connection that I don't feel like myself, which actually it is a symptom that the Menopause Society now, it is recognizing is such a thing as I don't feel like myself. It is perimenopause. And it can happen. Unfortunately, this is the number that all the gynecologists and reproductive doctors decided is the 35 years old. It is what we call...
That is rude.
It's called ovarian.
We're geriatric.
It's called ovarian aging. So they just decided
okay, that makes sense.
It's ovarian aging. But any year after ovarian aging, basically you are producing less and less estrogen. So it's going to be a moment that your body is going to start presenting to you with 1, 2, or 3 symptoms. This is perimenopause. So perimenopause can start as early as 40. Some women are late 30s, but I'm normally very uncomfortable with that number. So, but if a woman comes here with symptoms and is 40, 41, yes, it is possible. Okay. So perimenopause, very special stage of your life because it's all over the place. Yeah. We'll talk about it. So that's the definition of perimenopause. Yeah. So ovarian aging, which is important. Perimenopause, which is all the symptoms, and you still having your periods, you still produce estrogen, and then you don't, and it is a roller coaster. Then the day that you don't have your period anymore, you count 12 months, you're menopause, and after that, you kind of rebalance the amount of estrogen that you're going, which is in the low side, right?
Yeah.
And that's where you stay for then on.
Okay.
But knowing
Yeah.
will prevent you from those diseases when you are postmenopausal, like osteoporosis, like cardiovascular disease, like cognitive decline, that are dependent of your estrogen. They are not going to show up as a symptom during perimenopause. They're going to show up as a consequence in the future of lacking of estrogen. And that's when we're going to be talking about what's out there, the hormonal replacement, and all these little details.
Okay, perfect. I can't wait for that episode.
I know. And a lot of how this conversation started is Jules and I have both gone through the last couple of years at one point or another being like, we don't really feel like ourselves, or, we're looking forward to reproductive, wanting to get pregnant or wanting to freeze our eggs and things like that. So being able to look at ourselves from the inside out from a lifestyle perspective and really understand how we're going to start the process to continue to become healthier. So we don't lose it,
and that's a very important thing that I put here, because I want to mention, especially you girls who are still reproductive.
Yes.
So it is very important that everybody out there understands that doesn't matter that you're in perimenopause.
Yeah.
You still can be a mother.
Yeah.
Has nothing to do with that fact. The only problem is because of the non-typical cycles that we have during perimenopause, it's more difficult to exactly, let's say, plan that pregnancy, which still can happen on your 20s. But it is important that women, if I talk to women sometimes and I say, you're in perimenopause, I see the white face going, oh, I was planning to be a mom. Of course you can be a mom. This has nothing to do.
They're like just another label.
But just maybe perimenopause sounds like menopause. So you're not able.
We're all thinking menopause. I think that's what it is, and we think of our moms sweating and hot flashes and just like
Moody.
don't talk to her. Yes, let's go in the other direction.
Peris. You can call the Peris instead. We're on the Peris.
I like that.
The Peris instead of just like the menopausal sounds so like terminal.
Yeah.
It is. It's not. It's not at all. And this is a generation that maternity is arriving to those ages. Even like late 40s, early 50s are there. And absolutely, it doesn't mean your world has been closed the doors on you. That will be for the reproductive doctor just to make sure that everything in that environment is ready for you. Yeah. And speaking of that too, everything that is perinatal, so you can be menopausal, but we're not going to use the second part. Yeah. But you can be perinatal as well. Okay. Everything falls into the same category and is your metabolic health. Right. So because your baby's metabolism is going to reflect on the metabolism of the mother. Oh, so whatever you can do to your body to create that perfect environment that is dictated by your metabolism is going to dictate your baby's metabolism.
Wait, I did not know that.
So wait, and this is like very granular and very macro in saying this, but if you're an athlete, and we're going to go over our results. So I am perinatal. I'm trying to get pregnant right now, currently. I have an athletic build. I eat healthy. I work out-ish. But if I have a baby that's saying like my baby's going to have the athletic build and it's already predisposed to that kind of lifestyle.
So if you want to go granular, then if we take an athlete, athlete, despite that you always think, oh, is the healthiest person, we still can talk about the athlete making a little bit of a damage in their metabolism when there is such a thing as too much sports. Yeah. So we had this conversation fast that overdoing exercising, you still can put your body in a hypercortisolism, means your cortisol levels are always high just to maintain that level of adrenaline. And then that puts you in a kind of a toxic stress for a long time. So your body can be in
too much of everything is bad.
What was that?
Too much of something is always bad.
Except me. A lot of me is the best.
So more than athletic, I want to use the word a very balanced person who understands how movement and exercise totally matches their metabolism. Okay, because yes, an athlete, you always see them, the way they look, they have minimal percentage of fat. Well, I have news. I have a lot of athletic women through the early years too, 20s and 30s, very difficult to get pregnant because the weight and the percentage of fat in your body has to do a lot with the percentage of estrogen that is ready to make you ovulate. So there is something that we call the athletic triad, and they actually are in a process of infertility because their cycles are not happening due to the low weight and low percentage of fat. And they are anemic and they are prone to osteoporosis. So that's not a metabolic good state for me. And that's an athlete. So let's take someone who is like really focused on the way how they move, daily movement. And your resting metabolic rate is the number of calories that you burn at rest, and how much those calories have to be consumed, because this is the minimal amount of calories that your body requires to function. So if you don't, the body is going to be saving. So this is the kind of persons who say, I don't eat and I put weight super easy. And it's like, because you're not giving to your body what is required. So it's counterintuitive thinking that when you don't eat, you're going to put weight on, but it's such a thing. So that person, let's say we take a perfect balance, despite that person has the perfect environment, the nutrients, the vitamins, the fiber, and the normal flora, because I love everything that it has to do with the microbiome, because you pass it over to your baby actually through vaginal delivery and through breast milk. So the same bacteria of your normal flora, your baby will be starting to build up his own normal flora out of yours. So all this together is totally going to reflect in that baby. Muscle. So the metabolism of muscle, the mitochondria of muscle can be inherited by your baby. So I don't know, I saw that in an Instagram post saying, you inherit your mother's skills in sports. Has nothing to do with the ball, but it has to do with the strength and endurance. Doesn't have to do with the coordination to the ball. So, and I think that both had to do with the mitochondria. So mitochondria is basically the powerhouse of your cell. And the mitochondria has their own little genetics. And that genetic is 100% maternal. So that is the mitochondria, the one that determines your metabolism. So that's an important, interesting, granular, very scientific kind of fact, which is very interesting. Now, coordination and a father who was like a football player and making it's a different story, but I'm talking about how this metabolism works when it comes to the muscle and the resting metabolic rate and how much you have that potential. So we are all born with a potential. What we do with that potential is different. So nurture, right? Versus nature. So you have the nature, but whatever you are doing after that is up to you, because you can give birth to that perfectly athlete baby, but if that perfectly athlete baby goes through a process that unfortunately is not going to be exposed to develop the maximum potential, it won't. So, and there is this beautiful study, it's all about epigenetics. So epigenetics is this new concept that your genes being exposed to the environment, there is certain proteins that it goes on top of those chains of amino acids, and it can create different functions in your body because what you've been exposed to, right? So that's the whole epigenetics. An example of epigenetics, which is fantastic, is if I have a mother that suffers of obesity, so we talk about a third person, like not a direct person. When we say an obese person, we talk about a person that suffers of obesity. It's pregnant, and the possibilities that baby is going to inherit the tendency to suffer of obesity is very high. Wow! If I take that mom and I put her in GLP-1, and that mom loses weight, her epigenetics change, and she gets pregnant with a second baby. That second baby loses the possibility of being obese in the future. So it's very interesting. That's the article that it shows how epigenetics are super strong.
I mean, I didn't know that body type was hereditary. So if I saw my, a friend that had an overweight mom, and I was like, oh, I get it. Now, maybe that's very simplistic and whatever, but I would say like, oh, okay, I get it now. Like, we used to say big bone did back in the day. That's not even a thing anymore.
Right. Well, they always said it was always, because I feel like not an excuse, but part of when people were being unhealthily overweight, like not doing any of the right things. A lot of people leaned on, well, it's my genetics.
Yeah.
That used to be really the driver of unhealthy behaviors was, well, my whole, like, that's just who I am. But to break it down in this sense of, which I think my biggest takeaway to everyone who's listening is you can change the outcome of that if you are wanting to have kids.
Yeah.
And that's huge.
That's huge.
That is such a mind-blowing
I mean, just like
situation.
trauma cycles, right? Or, you know, familial generational traumas. You can break the cycle. You can break the cycle if you do the work, if you notice the patterns, and same with obesity and metabolic rates and all of the good stuff. It's like you ultimately, and this is why disease comes into, you ultimately have the choice to break the cycle, to fix the disease, but you have to notice it first.
Diabetics too.
My dad is diabetic, and he did the diet, and he's now no longer diabetic.
There you go.
Yeah.
So absolutely, yes. Now, I just need to move a bracket because we just talk about genetics and obesity.
Yes.
I would say 90% of the people who suffer of obesity does not carry any specific gene that is going to make them suffer of that disease, of that chronic disease. There is a percentage that are very related to a very specific genetics that even some of the doctors that practice obesity medicine, if we put someone in the process of weight management and we see that they don't respond for some reason to nothing, to everything that we're doing right, first thing we do is test for that gene. And that genetics just hope out there. If you ever positive for that genetics, there is a specific medication just for them.
Wow.
And that, but you inherited that directly, and it doesn't respond to nothing but that medication.
And then, and seeing the genetic biomarker you're talking about, correct? Like you have a biomarker in your body that's...
It's a gene. More than a biomarker, it's a gene. It's a gene. We look, it's a genetist looking for that gene. Like the BRCA gene for breast cancer, there is the specific gene for obesity. That's the specific obesity.
What's interesting to me is I've had, and I know that we've like literally gone down the rabbit hole on the genetics and conceiving, but I think this is really important. You know, when you're trying to get pregnant and they tell you lose weight, eat better, right? That is the idea. I don't think there is, because I mean, this was news to me, obviously. I knew like, oh, it's genetics. That's why you look, you know, you have traits, you look like your parents, whatever it may be. The idea that you can change the trajectory of a healthy baby, and obviously, you know, whatever goes in your body comes out with the baby, right? But I guess in my mind, if it really was genetics that continued this trajectory and hereditary issues, you couldn't get in front of them. But what you're saying is, as the mother, you can get in front of a lot of these health risks to prevent the baby from having that.
Yes.
Which is mind-blowing to me.
I mean, it makes sense.
I mean, it totally does, but like it just clicked to me going back to doctors in traditional medicine, just telling you to eat healthier and exercise. I've never had somebody who's been trying to conceive that they said, my doctor told me to do this because my baby is predispositioned to have these things. So if I get rid of them first, then it's more likely that they're not going to have it. Like, it's always eat healthy and exercise.
Yes. But it's a starting. Lifestyle medicine has the chapters, and one of the chapters is prenatal. So someone like you, Juliana, if you're just planning ahead, right? Because sometimes you're not planning and it's fine. I'm not saying it's not planning.
Yeah.
We're getting pregnant. We didn't know I got pregnant, but that's fantastic. We just, yes. But if you're planning, you can do so much to your metabolism to prepare that environment for that baby. And lifestyle medicine has a prenatal course for preparing the women for that.
So I know that the direction of today's conversation was really going to be like geared towards our results of recomposition, and we can absolutely. Let's start with Jules, actually, since we're on the prenatal topic, and maybe you can speak to a little bit of that as we're going through her results. Because one, I'm sure she wants to know that because we didn't really touch on a ton of it yesterday with the pregnancy.
No, I'm interested. I mean, I've already seen an IVF doctor, not because I need one, but it's always good to have a plan B in case I do not get pregnant naturally. And we did all my vitals and we did the ultrasounds and everything like that. So I'm good, and I'm doing steps. I'm doing the prenatals. I'm doing the CoQ10s. I'm exercising. I'm not overheating. I'm getting a lot of sleep. Like all the things. Yes, I'm doing all the things.
You avoid toxic substances and
Well, toxic like red wine.
No, that's good for your heart.
I'm Italian. I'm like, I'm fine.
It's Italian. But yeah, let's look at her.
But yeah, if we could look at the results in like that kind of like tunnel vision, that would be interesting.
And then for me, it's just
So DEXA scan is like we spoke about the technology behind. Nothing important. It's a software that is going to tell you those different body components. And we spoke a little bit about other kind of equipment that you can look towards the same thing. Example, the InBody. For example, some of those home scales that it will give you your percentage of fat, how much of that percentage of fat is in your visceral area, your lean mass, and your bone. But it is an estimation because this one is really like X-rays inside your body. So if we take Juliana, and the first thing we're going to do is the machine.
Those pretty bones.
Yeah, look at how gorgeous
Stunning.
She's like an hourglass. So the first thing is going to tell me the first page that the machine throws is the BMI. So we already debunk the scale. We don't want the number on the scale, means nothing. The second thing we're going to debunk is the concept of BMI. BMI being body mass index.
I love that for me.
Yes, I love that for me too, because because of my height and my athletic build, I have always been technically obese in my BMI my whole life.
Now you can debunk it, Tessa. You're not obese.
I am not.
Let's debunk it because this is just weight and height put it together in an equation. It means nothing. What is the rest?
Yeah.
So yes, she is 20 BMI, which falls into the little green zone here, like you guys see it. Anybody under, it's in the purple zone, which is underweight, and the rest we go overweight and class 1, 2, 3.
Yeah.
Totally agree with you. I have patients that they are incredibly built, and they, when I put the BMI, they are in the red zone, and all that they are full of muscle. So this is why BMI is very limited. It doesn't distinguish your muscle. It doesn't distinguish your fat. It doesn't distinguish the distribution of your fat. So we are going to focus on 4 important measurements through this scan. The first is going to be the total body fat. The total body fat includes the visceral fat. So it's how much percentage of fat you have in your full body. And then we're going to go into how much from that percentage of fat is around your visceral. When I say visceral, is your abdominal organs, your liver, your pancreas, your colon.
The bad fat.
Yeah.
The metabolically active fat that it will be reflected in your cardiovascular health in the future. So if we go to a percentage of fat, so these numbers here, the first number is the 29.8. That's the total percentage of fat of Juliana's weight. From that percentage of fat, if you see here in where it says VAT, that's visceral adipose tissue. So from that those numbers here comes in grams if I want to weigh it, comes in a volume, which is sometimes very interesting for the surgeons when they need like bariatric surgery. They need to know what they're getting. And there is the area. So the square centimeter has a lot of insight, especially the cardiologists love that specific measurement because we have like a number, which is like 100, right? All these standards are not they're not standardized yet. So all that I'm going to say numbers are some charts that I use from certain centers, very university centers, research centers, that gives me an approximation. So I know that 100 square centimeters is a lot of studies from the cardiology point of view. From above 100, you are at high risk of cardiovascular disease. Under 100, you're at low risk. We take 80 like a very optimal. You're still in the very healthy saving possibilities of increase your visceral fat. So that's why that number, which is the 29.1, she has a very low amount of visceral fat. So whatever percentage of fat, of total fat she has, it is mainly in her periphery. So it's going to be mainly in her subcutaneous fat, right? So around the muscles more than the visceral fat. So just a quick glance on this. Juliana is healthy. She doesn't have any metabolically active fat. Is something that I wouldn't be like, especially expecting to have a baby soon or expecting to get pregnant soon. I would say that part, the lipidic part of your body, is not going to be an issue. And then we go for the lean mass, and the lean mass. These two numbers, it's always based on your height. Obviously, the taller you are, the more we're asking you for muscle. So her number is 13.4, and I'm going to show you how this is going to reflect. When we talk about ALNMI, which is appendicular lean mass, we just distribute that lean mass on arms and legs because, interestingly, appendicular lean mass might be a reflection on how functional you're going to be in the future. And I'm talking about, that's when we talk about longevity, right? Because longevity, which is a buzzword and everybody wants to use it, really longevity means how many years can you live being healthy?
Right.
Know how many years period. Is how health span you have. So appendicular lean mass can reflect on how often you will be able to put your carry-on in the plane, in the plane, or to carry your grocery shopping, or to pick up your grandchildren, right? So this is where how much muscle is going to be determined of how much muscle you have in your arms and legs. I'm not saying that the core and the back muscles are not important, but as a marker of longevity, this is important. So
that's your everyday movement.
Yes, your everyday movement.
That is your how we get up in the morning, what we do. So
how you squat to buy something,
we can measure
you stand
that
up from a chair.
Then more than likely your interior is
You bend over, you're going to be able to get back up.
Yes, and
drop it low.
We take it for granted until we don't have it anymore.
Right.
So this is important. So this amount of muscle, we're going to see how this reflects in the other charts. So percentage of fat, so 29.8, and we put her into this kind of scale as a poor just because Juliana is an athletic woman, and I know her body type, like you were saying, which basically what it means with body type is how this slim kind of looking like people. What was the name of the person? The bone.
The big bones.
The big bones.
Big boned.
You were saying about how you used to call the big people. So different people looks different, but still very healthy. So I would like Juliana to go more into the good percentage, which is going to be between 20 to 23%.
Right.
So that's the percentage
Of fat.
of total percentage of fat.
Okay,
right?
so 20. I'm at 29 right now.
You're at 29 right now.
Okay, you want me to get to 23.
So let's say this is how we say no more risk of being in a high level of percentage of fat. And let me stop here, and we had this conversation. It doesn't mean that you have to lose weight.
Right.
What I need you is to that percentage from 29 to 23, right? That 6% of fat has to be converted to muscle.
Right.
Not losing weight, because the very interesting part here is if we continue and we see, well, we already spoke about her visceral fat, which is in a very low risk, very optimal and protective. And the way how her fat it is distributed is very protective as well, more in the lower part of the body, which is more of a pear shape, versus the upper part of the body, which is more of an apple shape.
Right.
So that 29%, it is very...
it's in good places.
It is in good places. It's in good places.
Properly.
Exactly.
In protected areas.
Correct.
Right? And it's the Yellowstone Park there. Not allowed to be touched.
But when we go to muscle, I can see how there is a lot of space for the muscle to grow. Right. So when I see your number that we say 13.4 kilograms per square meter, that's how much muscle you have based on your height, we just fall into the minimum healthy category.
Right.
And that kind of compares with the percentage of fat, because where there is no muscle space taken is going to be adipose tissue.
Right.
And the muscle, which is so active, will be so happy to grab that fat, feed from that fat and grow, and then your recomposition happen.
Right.
And that's the trick. That's exactly what a DEXA will guide us through. How much of that muscle has to be converted in fat, right? So we, without doubt, I want Juliana to go into the 16 kilograms per square meter to be in a longevity target.
Right.
And for that, I need you to put weight on. So, so this is what it is interesting and how precise is a DEXA scan, that if I do an estimation, this is just an estimation, if I want Juliana, based on those targets that we spoke, to arrive to that specific lean mass index, she has to put weight, but she has to put 12 pounds of muscle while losing 8 pounds of fat, but the muscle will take care of that.
Yeah.
So this is exactly what the knowledge on your body composition is. It becomes essential to understand how you look as a healthy person.
Yeah.
So if Juliana is 124 pounds today, most probably you need to be 128.
Yeah.
And then you're going to have less percentage of fat. Again, counterintuitive, but it's exactly what happened.
Well, it's also good if you throw out the scale, essentially that number, because if I was 120 and I would immediately go, I need to lose 4 pounds. Yeah. Because my happy place of like how I feel in clothes is anywhere between 120 and 125. Everything else after that, I do feel like my pants are a little tight, my shirts are a little tight, and then I know what to do in the gym. Now, I don't know what 128 feels like with
that additional muscle.
But
Exactly.
it's good to know, oh, it's good stuff.
Yes.
It's not bad.
Yes.
And it's just more room, because 128 on just a number scale, and if it was more fat, obviously it's like you feel it.
Yes.
I feel it.
Yes. Yes.
You know?
Well,
Yes.
I think that's why you're debunking the scale number too, because this is starting from a point of it's a 4 pound difference, right? That's all it is, except we have to transition. You're essentially losing 8 pounds of fat, which is a baby already. So like,
My God.
lose it now, and then, and then you'll know what it feels like again. No. And then adding those 12 pounds of muscle. So the scale does end up mattering at some point, as long as your body composition is supporting, because 128 pounds on you right now is a 4 pound difference of good weight versus bad weight.
Yeah.
However, there are people who could be 128 pounds and it could be
All fat.
12
And that's skinny
pounds
fat.
of bad weight versus good weight. Yeah.
It's because Juliana, it is judging that out of her size.
Yeah.
Talking about her clothing size. And if I tell you tomorrow, Juliana, I'm going to put you through a competition and I want you to be a weightlifter. And I'm going to put you're going to be 140, but just muscle. And I bet you need to buy clothes that are bigger.
Yeah.
But I put you in that DEXA scan and you are all muscle. And muscle is the organ of longevity. I'm not saying I want to change your body, but I'm going to give you an example.
Right.
How someone who might going to look more metabolically healthier from the muscle point of view might be 2 sizes bigger than you.
Right.
Yeah.
And the same Juliana. So it's important to know that, because this is a new generation.
Yeah.
Access to education is not the weight.
Yeah.
It's what's the composition of that weight.
And it's not BMI.
It's not BMI. BMI.
composition.
Don't judge a
Yeah.
body by just the body. You have to go
Absolutely.
inside.
Absolutely.
You have to go deeper. And this
Got to open the book and read the pages.
100%. So based on where she's at, she is in a good place to start trying to conceive, right?
Absolutely.
Like there's no red flags.
Not
or
at all.
anything.
Not at all.
Yeah.
And it's perfect. And actually, we know that because the amount of adipose tissue, especially adipose tissue, peripheral adipose
Yeah.
tissue, it is directly related to your cycles and estrogen.
Yeah.
Right? Because we spoke already about the athlete triad, and that's exactly what happened. They lose so much of that adipose tissue, then the whole hormonal dance of the estrogen and progesterone, we lose it. So, yes, that percentage is fat is perfect. Once we go through the baby, it's your hormones are going to start changing during pregnancy. That we know it is another hormone, and we can talk about it later too during that perimenopause, menopause, and hormonal world. So then it's the baby after. And then how that percentage of fat is important for you to produce milk too. So it is, all this is important, but in that process, then the baby, you said, okay, I'm done with the baby. Now I want to come back into my healthy weight,
Yeah.
right? And it's all about how much muscle we need and how much percentage of fat is permitted. Again, because this is a little bit strict and structured, looks like she's in a very poor level of percentage of fat. But the reason is not because she has too much fat, it's because she has too little muscle.
Yeah.
Right.
That's
Which
all.
is a different mindset.
And
Totally.
I love a good challenge. Like we went over the numbers yesterday, and I immediately was texting my fiance, and I was like, "We are going to lift weights," and he's like, "I've been waiting for you to say this."
Exactly. And the nutrition is important, but this is not about
Yes.
dieting. This is
No.
not restricting calories, 000. This is about eating healthy, feeding that muscle, increasing your muscle so your percentage of fat goes down. The only reason is because they went like this. But the baby is going to be happy that there is no visceral fat in there.
Yeah.
Obviously, all this is paired with other things. DEXA is not going to tell the whole story. Your resting metabolic rate is important. How many calories you are right now burning without a baby. You are going to multiply that because you're going to have a baby. You have to eat enough so the baby will grow happy. Your labs, everything, where your sugars are is super important.
Yeah.
Your anti-inflammatory state, right? So all these fruits that are anti-inflammatory, it is super important. The baby is going to be super happy with all these extra vitamin C and all these carotenes, many things that it comes from nutrition. But if I have to suppose that we're not talking about the baby and you say, okay, I prefer a better body than just that percentage of fat, all that I'm going to say to you is like, eat well, make sure that you feed that muscle and go and lift weights.
Yeah.
If I have to make it very a summary, but
Right.
this is it. But still, you still can lift weights, expecting to have a baby soon. You still can lift weights until, of course, there is certain limitations while you're pregnant, but it is not going to influence the metabolism of your baby if you start creating more muscle. For the contrary.
What if she won the lottery during pregnancy? Is that genetic? Like, would that pass down? I'm just trying to figure out what she can do during this pregnancy that'll just, set us up.
Set us up for what?
Just for life.
Oh,
Yeah, left the fiance and the pregnancy idea, but you're stuck with me, so I'm not really sure.
obviously.
Can it be more than just genetics is what I'm saying.
I think that now it's like you have genetics, and then whatever I'm doing in my body turns into genetics for my baby.
Yeah.
Ultimately. So whatever I want my baby to have, I need to plan accordingly and do it.
And that's
expose
why
the baby.
that's why when our moms would eat my mom ate jalapenos the whole time that she was pregnant with me, and I love a good spicy treat. All the
Our
time.
mothers will tell us, right? Because I was eating in your pregnancy. It might be something like this.
So when a woman or a man, because I assume that you have men clients too.
Yes, they care about their metabolism too.
Right. Especially in South Florida, men and women care about what they look like.
Yes.
So when they come in, and they obviously have their other doctors, do you work with the other doctors? Do you just say, hey, just give the other doctor this stuff?
I love to work with other doctors.
Which makes more sense.
Because it
Here are
sounds like
two
you need a
videos
team
that we
around you.
referenced
You
I
know?
do
in
have a team.
the
I have the
episode.
nutritionist, I have
Yeah.
the fitness coach here.
Yeah.
I have the behavioral therapist, which does amazing things too. But your PCP, it's amazing if he wants to be part of the team. Unfortunately, I sometimes find, and I've been lucky. Let's say from every 10 PCPs, I have 2.
What is a PCP? I'm sorry.
I'm sorry, a primary care physician. A primary care
I don't
physician.
have any of those. I am if I'm not sick, I don't go to a doctor.
Yes, it's true. We had this
I
conversation,
go to
which
my
it should
gyno.
happen. It should happen.
That's what I do.
Yes. Yes.
Female health is very important for me.
Yes.
But if I'm not sick, I don't take a pill. I don't take Advil.
It should be like that.
Right.
Totally.
Yeah.
Unless you're doing preventive medicine, so you come every year and say, what's new? Test me head to toe.
Right.
To see
Just
what I
checking
am.
the engine
a
of the
good
car.
EKG,
I get it,
your
yeah.
DEXA things is going to tell us a story.
Yes.
But that's it. But normally when someone has their own primary care, and I already heard some feedback from my patients going, wow, my primary care was very impressed that now we have this plan. Some primary cares are very intelligent and said, oh my gosh, she does have the time to sit down and go through every part of their metabolism with my patient. So now my patient is avoiding all these diseases. A primary care should think like that.
Yeah.
But because most of those primary care belong to the system, you only see your primary care for 9 minutes, and then you don't even remember how he looked before.
Right.
They just next. I don't care who you're seeing. Go for it. You know, I'm the one under your insurance. That's why you're with me. So 8 of those primary cares that they don't follow along with me. Some of my patients really come and say, I think you know my body better than my primary care. And I get involved into their care. Yes.
100%. And I think that it's important, like even for you who is board certified, how many times in multiple things?
I have 3 boards and I have 1 certification.
She's probably going to get a 4th one, right? Even from you in the very beginning of this podcast, you said, I still did my research on lifestyle medicine. So if we have a triple board certified doctor in here doing her own research on certain new medicines as well, kind of going back to, it does take a village, right? But if you don't feel like you're getting the answers from your PCP, seek other outlets. Like there's no problems having additional conversations or doing something from this perspective. Like this to me fits us because, and the interesting thing too is Jules and I are incredibly healthy. You guys know that, we talk about it all the time. So for us to see the results of our own scans and know that we still have work that we need to do should give everyone hope that like
we're not perfect.
Everybody, okay.
Yes, they are.
I was going to say everybody and everybody is different. So you got to start somewhere, right? And I think, not to cut this short, but I think this was a really good episode just to focus on prenatal. I mean, we really did it. So I think when we do the menopause,
we'll go over your
scans. We'll go over mine because that is more where I'm at with the, I'm not really feeling like myself and some of the different things that I've done. But I mean, this episode really bow tied around what we were talking about.
I do love it, but I want, just because you mentioned how you come to me at this moment, this is all preventive medicine.
Yeah.
And this is all modern medicine. Yeah. This is not the medicine that it has been practiced right now by, let's say 80% of the physicians are not practicing this modern preventive medicine. Last year,
that's a big number.
It's a big number. Last year will be 90%. Today, I'm so happy we're right now in 2026. When I said I own a metabolic clinic, longevity clinic, and I do a lot of preventive medicine, before everybody will ask me how that looks like. Do you own a med spa? And I'm like, I don't. I want you to feel like you're in a spa, but this is not a med. This is not a med spa. Yeah. But today they say, oh, I get it. Like half of the patients will. Now, many doctors are flipping towards we need to invest in preventive medicine. Yeah. We need to acknowledge metabolic health. It is essential. If we don't start from that point, it is ridiculous that all that we're doing is prescribing. Yeah. Side effects.
I agree with you. I feel like, not to cut you off, she didn't tell you I do it all the time.
I'm actually very happy that you did that. We haven't had you cut us off yet. This is the standard in our podcast.
But one, our generation, we're very in the know. Yeah. And it's because of your generation being in the know before us. And then we have social media and you're spreading the word and we're just absorbing everything. And 2, we're so tired of being on the defense all the time that we're actually in the driver's seat and we're on the offense. So we're seeing more numbers in the Alzheimer's and in the dementia field. We're seeing more in the obesity. We're seeing more in the numbers in all of the cancers. Like our friends alone, like I've had 3 friends and in the age of 35 to 40 in the cancer realm. So being on the offense is really important for us. Being like, we're not it. Like, choose someone else. Choose a different generation.
Yeah.
Well, you know?
I think the key word too is
generation.
Yeah. Well, it's preventive, right? I feel like in corporate America right now, it's reactive. We're trying to be proactive, not reactive. So we're trying to be preventive, not what would it?
We're not putting the Band-Aid on already bleeding.
Right.
Yes.
Well, and you know, it's easy to have a quick fix, right? But it's never a quick fix. It's your body. You get one, take care of it.
Yes.
Yeah.
It is. But you guys are absorbing all this. But you're going to continue educating the generations behind you. And you're going to be the mothers of those that you're going to teach them as well. And again, we don't have to be extreme. I'm not going against medication. Thanks to medications and to many things in modern medicine, we're alive.
Yeah.
There is no such a thing as survival on cancer in the past.
Yeah.
Now we start
Right.
seeing survival of cancers. Cancers are seen less, still they're evil, but not as like before.
Right.
It was terminal. Not today. Many cancer survivors go through a second and third cancer. Still, we
Right.
have everything there. So we have to be grateful from that pharmaceutical. But we've been abused that. We abused that for a long time. And now our parents abused that. So this is how we are starting to react. And now with the sick system,
Yeah.
now we're losing the trust of our patients, which
Yeah.
they are giving us the most important treasure of their life, which is their lives. So
I mean, me and Chat, we have a relationship.
well, I think many people has a relationship, different Chat, but a Chat.
So is there anything before we wrap up today? So we really honed in on
Yeah, what would be your key takeaways, like your 6 pillars, like you said,
Yeah, the 6
of
pillars,
nutrition
like that.
and healthy relationships? What would be the 3 big takeaways from this episode that you could say?
First and foremost, I think education was the main objective of today,
Yeah.
based on whatever questions you guys were having. The concept of metabolic health.
Yeah.
Let's start from there. Metabolic health, it is the start of everything. And your metabolic health can be read in a very specific way to you. And then once you know your metabolism, you define your objectives and you always can achieve those objectives knowing where you're standing from. So a doctor like me should be giving you the roadmap. Forget about those paternalistic doctors who's going to tell you what to do. And if you don't do it, you didn't pay attention to me. Well, your problem. That's over. This is obsolete. So obsolete paternalistic medicine, metabolic health, it is the starting point. 3, debunk all these stupid things, right? So you go to your doctor, the doctor said BMI, you said that's not right.
It's nonsense.
I don't think. If we don't have the high expensive equipment like I have here, a waist circumference. A waist circumference will reflect how much visceral fat you can have, and you guys can Google what's the charts on a healthy waist circumference or not. So that's your metabolic health still can be measured with simple things. And then let's debunk BMI, let's debunk the weight in the scale, and let's remember that the way how we practice lifestyle medicine can be a way to trust back in medicine. And if you find, there is a lot of us out there that they are traditional doctors. I do love functional medicine, but I consider myself more of an integrative medicine that I add to my traditional medicine, functional medicine. And all of us together, we're happy to take care of you and your health. So trust back, just recognize who is not practicing the way how you should be doing. We should be doing it, like putting you at the center, informing you so you make an informed decision. So education and informed decision should be the way to go for your goals in health. And remember the whole marketing and business out there, you might gonna need an expert to clean the noise so you guys don't have to go all the way to spending thousands in supplements and things that maybe working for an influencer, like we spoke yesterday, good for them, it works for them, but everybody's so unique that precision medicine should be the way how you guys are going to be told how your metabolism works.
approach it like you do relationships. If you're confused, it's probably not a good fit.
And everyone's different.
And everyone's different.
Well, you also have to be your own advocate. Like if you know if you know,
I love that. Yes.
If you don't have a good feeling about a doctor, you don't have to stay with that doctor.
Absolutely.
You know, you don't have to you could shop around. It's really important to do that. But thank you, Dr. Paola. We love you on Karaoke.
We're basically just going to be here all the time, you guys.
You're welcome, girls.
So thank you so much. This is the first of many.
Yes.
And we are going to break it up because we have so much to talk about. And just cheers to you and
Cheers.
thank you.
Yes, thank you.
Perfect. And we'll see you soon.
Thank you for watching this episode of Karaoke Wine. Please like and subscribe.